Welcome to Breaking Down Mental Health with Dr. Jones. In these educational videos, Dr. Jones will discuss mental health diagnosis, clinical supervision, using technology in counseling, multiculturalism, and many other topics to help you get a healthy understanding of why mental health is important. Please don't forget to like, subscribe, and hit the notification button if you enjoy these videos.
Think about those moments maybe in your own work where you went from just following the steps to really getting it, understanding the core of what you're doing.
Yeah, that leap, it's huge. In clinical work, that leap is all about grasping the why behind what we do, not just, the what.
Exactly. Knowing a technique is step one, sure. But figuring out how it actually fits a specific person, their life, their struggles, that's where the real skill comes in.
Absolutely. That deeper insight is what lets us, tailor things properly, make treatments stick. It's how we move beyond just managing symptoms.
Which leads us right into our deep dive today. We're exploring how to really nurture that why. Specifically, we're looking at Dr. Jones's approach. He's a counselor, educator, a supervisor.
Right. And he has his focus on teaching supervisees to truly think like clinicians. And his main tool for that, case conceptualization.
So case conceptualization, let's break that down a bit. In practical terms, what are we talking about?
Okay, so basically it's the skill of connecting the dots. You take the client's story, their symptoms, their history, the context they live in, and you weave it all together into a coherent picture, an understanding.
Yeah.
That picture then guides, everything you do in therapy. It's getting to the roots.
Getting to the roots, I like that. And Dr. Jones, he uses Bernard's discrimination model quite a bit in teaching this, right? Adapting it.
Yes, exactly. Bernard's model is, really flexible. It lets the supervisor shift roles, teacher, counselor, consultant, depending on what the supervisee needs at that moment.
Okay.
And Dr. Jones is really skilled at layering that case conceptualization focus within those roles.
Yeah.
So it's integrated, not just tacked on.
Gotcha. So our mission today really is to unpack this crucial skill case conceptualization and see how Dr. Jones helps his supervisees master it, moving beyond just knowing techniques.
To truly understanding why a specific approach makes sense for this particular person right now.
Right.
That why is key.
That's the difference maker, isn't it, between someone just applying tools and someone being genuinely effective.
It really is. And it helps avoid what Dr. Jones talks about, clinical autopilot.
Clinical autopilot. I think we can all relate to that temptation sometimes.
Definitely. It's easy to fall back on what's familiar, what feels comfortable, but the goal is to move past that.
So how does Dr. Jones nudge people off autopilot?
Well, a lot of it comes down to reflective questions.
Yeah.
He really encourages supervisees to constantly ask themselves, sort of fundamentally, why this intervention? Why now for this client?
Seems simple, but digging into that why probably forces some deep thinking.
It does. And he pushes it further, like asking, how does this choice fit with their cultural background or their developmental stage? What about their unique life circumstances? Adding those layers.
Right. Context is everything. There was an anecdote you mentioned about a supervisee who leaned heavily on CBT, cognitive behavioral therapy.
Yes. So instead of just saying, don't use CBT, Dr. Jones got curious. He asked, okay, tell me why CBT for this specific client at this specific moment.
And what happened?
Well, initially the supervisee found it a bit tricky to really articulate the connection beyond a surface level. They couldn't quite nail down why it was the best fit compared to other options for the client's core issues.
I see.
And that hesitation, that struggle, that became the teaching moment. It wasn't a criticism, it was an opening. Dr. Jones could then guide them to think more broadly, maybe consider other angles, or perhaps how to tailor CBT much more precisely.
So it wasn't about CB2 being good or bad, but about developing that clinical reasoning, understanding when and why any approach is the right fit. That leads to more deliberate choices.
Exactly right. More intentional work. And in that specific interaction, you can see Dr. Jones operating in that teacher role from Bernard's model, right? Giving direct feedback on clinical thinking.
Makes sense. But he probably uses the other roles too.
Oh, absolutely. He might shift into the counselor role, exploring if, say, the supervisee's own comfort with CBT or maybe their training background was playing too big a role, looking at potential biases.
Right. Our own stuff definitely creeps in sometimes.
It does. So helping them see that is crucial. Then maybe he'd switch to consultant. He might ask something like, okay, putting it all together, what direction do you think makes the most sense now?
Fostering that autonomy, getting them to own the clinical judgment.
Precisely. And that ties into another technique. He uses something he calls the connect the dots method.
Connect the dots. Tell me more.
It's pretty straightforward, but really effective. He basically assesses, can the supervisee clearly and logically explain the line from the client's main problem to the intervention they've chosen?
Okay.
If they struggle to draw that line, to articulate that connection, well, that signals a gap in their conceptual understanding. They might know what to do, generally, but the why is fuzzy.
And those fuzzy moments aren't points of failure in his view.
Not at all. He sees them as invitations, opportunities to pause, unpack the thinking together, explore the decision-making process. It's collaborative.
That sounds like a really supportive way to learn. Fosters a safe space to question things.
It does. It builds that muscle for critical thinking, for flexibility and reasoning, which is ultimately what you need.
So if we were to boil down Dr. Jones's core philosophy for supervision, what would it be?
I'd say it's about nurturing critical thinking, building clinical independence, and always grounding the work in a real human connection and understanding of the client.
That's a great summary. Creating clinicians who aren't just technicians, but thoughtful, reflective practitioners.
Exactly. People who are attuned to the nuances of each individual they work with.
And it circles back to those two key questions he encourages everyone, not just supervisees, but all clinicians, to keep asking themselves.
Yeah, these are really powerful for anyone in the field. The first one is basically, when was the last time I really paused and asked myself why I'm choosing this path with this client?
A call for mindfulness in practice, essentially. Stop the autopilot.
Right. And the second one dives into self-awareness. How might my own background, my experiences, my biases, how might they be shaping how I'm seeing this person and their situation?
That's so crucial. Constant self-reflection.
It really is. And perhaps for you listening, especially if you're in a supervisory role, it raises the question, how are you helping your own supervisees develop this kind of thinking?
Yeah, what methods are you using to help them connect those dots, to build that bridge between the client's unique story and an effective plan?
It's definitely an ongoing journey, isn't it, for everyone involved, refining how we teach and how we practice.
Absolutely. Exploring these ideas, thinking about how we foster that deeper reasoning, it ultimately strengthens our field and helps the people we aim to serve. So maybe a final thought to leave you with: what's one approach you could explore or maybe implement starting now to strengthen your own clinical reasoning or help someone else strengthen theirs? Something to mull over.